Reducing patient wait times, improving workflows, and having real-time analytics into the patient journey is crucial in today's complex healthcare environment. By improving shared visibility on care milestones, health systems align clinical care delivery and patient journey mapping with automated workflows that are integrated, maximizing efficiency so providers can maximize patient satisfaction, improve staff productivity, increase throughput capacity, and decrease patient encounter times throughout the entire engagement cycle. Take, for example, the journey of Douglas Miller, who has arrived at the clinic for a series of 3 oncology treatments taking place throughout the facility. First, a CT scan, followed by an appointment with his oncology provider, and finally, an infusion. While checking in at the front desk, he receives an RTLS-enabled badge, which will be returned after he completes his treatments and before he leaves the facility. Once the reusable badge is activated, the clinic electronic whiteboard updates with HIPAA-compliant imagery to display where Mr. Miller is in the facility and how long he has been there. The first stop in Mr. Miller's journey today is a CT scan. Once he is called back to his scan, the electronic whiteboards update to show where Mr. Miller is in the facility, so team members involved in his other appointments can see where he is. After 30 minutes, Mr. Miller is scheduled to make his way to his oncology appointment. The nurse in oncology notices that Mr. Miller is 10 minutes late for his appointment, so she uses the electronic whiteboard to view Mr. Miller's location and see that he is in the restroom. She decides to complete another task while awaiting his arrival. Once she sees that Mr. Miller has arrived at oncology, she calls him back for his appointment, and the electronic whiteboard is updated with his new location. After Mr. Miller departs from his oncology appointment, he makes his way to his infusion. When it's time for his appointment, Mr. Miller is called back to the infusion chair and the clock begins tracking his visit. Once in the chair, his nurse needs to locate an infusion pump, and because assets are also tagged into the system, he's able to pull up the floor plan view in asset tracking and easily locate the nearest pump in the supply closet across the hall. He retrieves the pump and the infusion can begin. Once the infusion is complete, Mr. Miller's badge is returned to the departure drop box. Knowing exactly where patients are and how long they have been waiting for care is how health systems can find the most benefit from an automated workflow solution with RTLS. Enhance the patient experience in acute and ambulatory care settings. Drive process improvements with performance-based reports and dashboards. Improve throughput communication for better patient and physician interactions. Reduce delays as the patient moves through their care journey. Utilize touchless workflows for clinician and staff efficiency. Contact us to learn how an infusion clinic found a 16.5% decrease in patient wait times and 18% increase in patient volume while utilizing an automated workflows with RTLS solution.